Antibiotics are used to kill bacterial infections such as pneumonia and also strep throat.
But according to state health officials, millions of unnecessary antibiotic prescriptions are written every year. In today's Health Check, Delane Cleveland has more on why that's bad and what the health community is doing.
Visit any pharmacy and you're guaranteed to see antibiotics sitting on the shelves. At this pharmacy in Richfield, staff members are busy filling bottles with the multicolored pills.
Penicillin, amoxicillin are common antibiotics that I would prescribe.
Jenny Schmitz is a physician assistant at the HCMC Clinic in Golden Valley. She says if people come in to see a doctor, generally they want to leave with a prescription.
Of course they want to feel better, and the common perception is that antibiotics are going to make them feel better, when in reality that's not the case for a lot of the time.
But according to the Minnesota Department of Health, each year in the United States, doctors' offices prescribe 47 million unnecessary antibiotic prescriptions. As a result, that's led to the emergence of antibiotic-resistant bacteria.
And the big problem is that we are not developing new antibiotics at the rate that we're becoming resistant to the ones we have. So at some point, there's going to be a bigger problem if we continue in the path that we're moving right now.
To prevent those problems, health officials urge people to do things like wash your hands properly. Doing so will help you avoid infections and decrease the need for antibiotics. Or if you are prescribed an antibiotic, finish it completely and don't share your medication with anyone else.
It's prescribed the way it is because that's how long it takes to eradicate bacteria.
Experts also recommend that patients avoid asking their physician for antibiotics when they're not needed.
You know, if you go in and your provider says, gosh, I think this is viral, trust that they know what they're talking about.
Doing so could prevent long-term consequences.
It is a distinct reality that we could develop more widespread cases of resistant bacteria.
For Health Check, Delane Cleveland, 12 News.